Good afternoon, everyone. Thank you for being here today. Today represents a big step in Arizona's fight against the COVID-19 pandemic. We're going to start out today with an update from Dr. Kara Christ on where we are with COVID-19, and then I'm going to be back for some announcements. Dr. Christ?
Thank you, Governor. So we wanted to provide an update on the trends our public health experts are seeing in Arizona. We continue to remain concerned about the metrics that we're using to monitor COVID-19 transmission throughout the state. That includes cases, percent positivity, and our COVID-19 patients in ICU and inpatient beds. So to date, a total of 429,219 cases have been reported to public health. And last week, the week of December 6th, the percent positivity was 18%. This week, we are trending higher. The COVID-like illness metric is always also trending upwards, indicating increased visits to our emergency rooms and admissions to our hospitals for COVID-19. And our hospitals continue to see increased demand and increased usage of inpatient and ICU beds. We are asking everyone to avoid gatherings with people you do not live with, especially for the holidays. There are simple steps that everyone can take to reduce the risk, and that includes wearing a mask anytime you are with other people that you do not live with. Reduce the size of your gatherings, stay physically distanced from those who you do not live with, and wash your hands frequently. We share everyone's excitement with a COVID-19 vaccine now in the state, but we still have a long way to go before everyone is vaccinated. So until then, it's critical that each of us take steps that are proven to reduce the spread and protect our most vulnerable. Thank you.
Thanks very much, Dr. Christ. This Monday, the first shipment of the COVID-19 vaccine arrived in Maricopa County. This is an historic achievement, and I can't emphasize this enough. In less than 9 months, we developed a safe and effective vaccine for a virus that has upended our way of life. And with hours of approval, distribution across our nation began. This monumental effort is the direct result of the hard work of many. I want to recognize all the scientists, public health leaders, healthcare workers, frontline workers, and trial participants from here in Arizona and across the country. We are so grateful, I am so grateful, for your dedication and perseverance. On behalf of the many Arizonans who know someone in a hospital bed, the many Arizonans who know someone in recovery, and the many Arizonans who know someone who is at risk, we say thank you. It is because of your efforts that we will be able to save thousands of lives and finally begin to put this virus behind us. In just a few hours, some of the first vaccine shots will be administered to 10 of Arizona's extraordinary healthcare workers. These individuals are among the first of many dedicated frontline workers who've signed up for the vaccine. Regina Villa, a nurse at Valleywise Hospital, who's provided bedside care to COVID patients throughout the pandemic. Captain Paramedic Jeff Steiber, a 27-year veteran of the Mesa Fire Department, who has helped distribute thousands of vaccines to Mesa's children. And Will Smith, an Arizona National Guard specialist from their medical team, who has administered COVID tests to over 1,000 individuals across the state. The other vaccine recipients include Dr. Edmund Baker, an Army veteran and community physician, Dr. Ross Goldberg, a surgeon and president of the Arizona Medical Association, Allison McCabe, a newly minted registered nurse, Alabunmi Anadeko, a certified nursing assistant, Captain Kenny Overton, a 15-year veteran of the Phoenix Fire Department, Eddie De La Torre, a registered nurse, and Dr. Kara Christ, the director of the Arizona Department of Health Services. Dr. Christ has begun guiding Arizonans through Dr. Christ has been guiding Arizonans through this crisis for months. Today, as a doctor and a public health expert, she walks the walk. Her confidence in the vaccine should give all of us confidence in the vaccine. These men and women are in addition to a World War II veteran, healthcare workers at the Phoenix VA and Tucson Medical Center, members of the Navajo Nation, and others who received the vaccine yesterday. These brave people have seen the virus up close and personal. They've treated those needing care and seen how devastating the virus can be to individuals and families. They've been there for the 429,000 people who've tested positive for COVID-19 and more than 7,530 who've passed away. And now our medical personnel have stepped up in another significant way to get this vaccine. This is a significant step in the fight against COVID-19. For the first time this year, there is light at the end of the tunnel. But I can't overemphasize this enough. The fight against this pandemic is not over. Far from it. I need Arizonans to continue to do their part in slowing the spread of this virus. This means, of course, following public health guidelines, wearing a mask, washing your hands, physically distancing yourself, and limit your time with the most vulnerable. And today we have another ask, to please get the vaccine when it's available to you. Public health experts can't overstate the importance of this. I cannot overstate the importance of this. We need Arizonans to step up and get the vaccine if we want to stop the spread of this virus. It's our best shot at returning to normalcy. Our hospitals have been working especially hard to deploy vaccine sites as soon as possible. I know Banner Health has been using the state fairgrounds to do testing, and they expanded their coverage to administer flu shots. Now they are going the extra mile and expanding their fairgrounds site to give the vaccine to healthcare workers from across the valley. On top of this, we have vaccine sites opening up tomorrow in North Phoenix and Pima County, and we'll begin administering the vaccine at our nursing homes before the end of the month. In less than a week, we should have vaccine sites in every county in Arizona. As I said before, the vaccine's arrival is a crucial step in the long-term fight against COVID-19. But that's in the long term. In the short term, we still have challenges to overcome right in front of us. Right now, our hospitals and our state are under considerable pressure. We know they are being pushed to their limits, and we want to assist them as much as we can as we enter this next phase. Today, I'm announcing that we're distributing $15 million in additional funding to the Department of Health Services for public health emergency needs. This will help replenish our public health emergency fund and give us the additional resources necessary to continue the fight against COVID-19. I'd now like to introduce Major General Mick McGuire to give us an update on the National Guard's efforts to combat COVID-19. General?
Thank you, Governor Ducey. Good afternoon. I just wanted to update all our fellow citizens on a couple of things that have come up over the last couple of press conferences. First, we have finalized and received back from FEMA and DOD the approval to extend the task force for up to 800 National Guardsmen through March 31st of 2021. Currently, we have 697 on duty today. We're bringing in another 78 medics to bring it up to 775. Those medics will be part of 5 pods that will be opening in Maricopa County here and 4 other locations over the next 3 days. Once they're trained, we plan to deploy them out to first Mojave County and other counties around the state that have requested assistance in the rural areas, as well as tribal nations. On the tribal side, we were able to receive from the federal government 24 naval doctors, nurses, and medics that have been deployed to Chinle and Shiprock, New Mexico, to assist the Navajo Nation. Those 24 docs will be there over the next 6 weeks, assisting with not only response in therapeutics to the disease, but assistance with vaccinations. And I know many in the media saw recently our federal partners here in the state, both at VA and other federal facilities around the state, have begun this process, and we hope to quickly, as the governor said, use these pods of our medics and folks to get out to the nursing homes as quickly as possible over the next couple of weeks as we continue to try to help those most vulnerable. So thank you very much for the support, and I continue to work strongly to support health services in all the counties and tribal nations around the state. Thanks.
Thanks very much, General McGuire, and thanks for the hard work of the National Guard and how they have taken every challenge and met it and delivered for Arizonans. So, lastly, allow me please to state the obvious. The Christmas and holiday season is upon us. And Christmas is, of course, a celebratory time. It's a time for us to connect with our loved ones. We want to make sure that people are connecting with their families during the holiday season. And the most important thing is that we do it in a safe way. We have to keep our guard up. We have to remain vigilant at this time. So please, limit the size of the gatherings. Celebrate outdoors in any instance which you can. And I'd add, please connect virtually. I'm personally amazed by the way our technology has allowed us to stay connected with loved ones this year. And of course, we would much rather see our loved ones face to face and in person and give them a hug. But when it's appropriate, we can still see their faces and hear their voices. And it's important that we do that, and it's important for them to have that connection as well. Connected with our loved ones has been crucial as we've navigated through the pandemic, and it's even more important during the holidays and Christmas time. I hope all Arizonans can stay connected with their loved ones and family and friends this holiday season. And with that, CJ, let's open it up for questions. Thank you, Rachel. And let me touch again on the mitigation measures that have been in effect since July, since the last time we were in this situation. Our economy, of course, is different today. And the fact that we've limited capacity inside our restaurants to 50%, gyms at 25%, bars being transformed into restaurants at that 50% capacity. The fact that in any setting inside these places or anywhere in our economy, people are masking up. If those mitigation measures will continue to be followed with accountability, we'll be able to navigate through this, and those will remain in effect. If you look at where our spread is happening from right now, it's really happening from gatherings in private settings. And that's why I'm asking for the public, which has been so responsible, demonstrated so much common sense through this, to keep their guard up and to stay vigilant. Likely, what the challenge we're facing right now is a result of those gatherings several weeks ago. That's why I'm talking about Christmas time and the holidays and being as responsible as possible.
I just have two really quick ones. When will you be getting the vaccine, and then are you gathering with anyone outside your household?
So I'm going to get the vaccine when it's my turn. Of course, Dr. Kara Christ is getting the vaccine today, and like I said, her confidence as a medical doctor and a public health professional should give people confidence in the confidence that she has in the vaccine. I am not determined in, I think, what we call Group 1A. I think it's in Group 1B or beyond that. But when it's my turn, my sleeve will be rolled up and it will be administered. And I'm going to be gathering with family, and I'm going to be here in town, much like I did for Thanksgiving.
Nicole, I think you had a previous question.
Following up on Rachel, we have hospital leaders, county level public health leaders, researchers, university modelers, all calling for stronger mitigation measures. You've ignored them, instead gave money to restaurants where the caseload has reached near crisis levels and deaths are rising. Are you not going to reconsider stronger measures
So
to protect Arizona?
So first, I want to say I'm not ignoring anyone. I'm listening to everyone. I'm taking the best counsel and advice and putting those steps forward, and that's what we're going to continue to do on what's right for Arizona.
Governor, you have said several times that you mourn all those who we have lost to COVID-19. Yet when given the opportunity to save lives, you have not acted.
That's not true.
Expressing grief, do you feel you owe them?
That is not true. The way you are framing the question is a mischaracterization of what we've done. There are steps in place. And if many of these leaders that are reaching out and asking for additional actions would actually enforce and have accountability around the steps that are already there, we can further reduce the spread of this and save lives. Those are the facts, and that's the actions that are necessary.
I feel you should apologize to these families. You're given the opportunity to do.
We're doing everything that we can. I have said that we mourn and grieve every death. It is the virus that is taking these lives. The vaccine will save millions of lives going forward, and that is our focus today.
Let's go to Juan from Telemundo.
I wanted to ask you about your impression of the site here first. They gave you a small tour here, but we have other places that are supposed to open. How do you feel about these locations? Do you think they're going to be able to handle the amount of thousands of people that are expected to come through here? And also, you can just answer that.
Sure. Thank you, Juan. To speak specifically about this site, I'm very impressed. I'm very impressed by our health care workers. I'm very impressed by Nancy, who is running this site and gave me the tour and showed me how we are going to have the flow of people in here so we can get these vaccinations completed. We're going to begin with 380,000 vaccinations this year, or vaccines, in this calendar year. Of course, we're going to start with our doctors and nurses, hospital staff, and emergency medical personnel. Then we're going to go to our most vulnerable folks in long-term care and our skilled nursing facilities, our most vulnerable, getting out to our rural areas and our tribal nations. This is our largest metropolitan area in the state of Arizona. It's the 5th largest metropolitan area in the country. And I think what Banner Health is doing here, what the fairgrounds are doing, will get us off to a great start with a successful uptake in these first 380,000 vaccinations. It's really the hundreds of thousands and millions of vaccines that follow is what we're going to have to stay focused on.
Do you think we're going to be using this facility for the next phases for also like the general public to be coming through here as well?
Yes, we will continue to use this facility along with other facilities that will be posted on the Arizona Department of Health Services at the appropriate time as the vaccine does go out to the broader public. Thank you, Juan.
Let's go to Bailey, who came up from Tucson.
Hi, Governor.
Hi, Bailey.
I have spoken to ICU nurses, doctors at Banner, and they literally cry. I mean, I have witnessed them cry in front of me because they have to hold the hands of people who pass away and their families cannot be there. They have requested more safety measures in place, as you know, the curfew that just occurred last night, I guess, in Pima County. What do you say to those healthcare workers who are crying for something else to be done? What do you say to them?
So first, I want to say to the healthcare workers, thank you for what you're doing. You are the heroes in this situation among many. The doctors, the nurses, the people that work in our hospitals and are on the front lines for COVID-19. We're doing everything we can to slow and contain this spread. We do need people to continue to be responsible. And we also need the owners of these establishments to make sure there is accountability for these mitigation steps. These mitigation steps have been put in place to break up large group gatherings of adults. And by and large, that's what we've seen. Of course, there's going to be an outlier here and there, but what we've seen is that we've been able to do things in a safe way. Where most of the spread is happening and where the folks that are in some of these situations are because of the larger group gatherings that are happening in private settings. And then folks that are at that category of age or vulnerability or comorbidity catch this virus, and they are filling our hospitals and our ICUs. So the best thing that we can do is, one, of course, personal responsibility from individuals, which the overwhelming majority of Arizonans have demonstrated, and then accountability for these mitigation guidelines at the local level. Where you see the accountability at the state level has almost exclusively come from the Department of Health Services.
And one last follow-up to that. Do you think, I mean, given the leadership role you have, obviously, is there anything else you can do?
Well, of course. I think what we have in front of us right now in terms of, I mean, we're here today on a historic day, as I said, which is really a miracle of modern medicine, of our public health officials, of a private-public relationship, of an operation called Warp Speed that is delivering something that can put this behind us. I do think that there should be a healthy, dynamic competition among the states to share best practices on how to most effectively not only bring the vaccines to the state, but the real measure of success is vaccinations. So it's one thing to have the supplies here. It's another thing to move hundreds of thousands of people through a queue so that they get these vaccinations. And it's also to build confidence in this vaccine, that it's safe, that it's effective, it will save lives, and it will bring us back to a sense of normality in this state and in this country. That's what we can do.
As you mentioned, that's the long term. I know you mentioned in the short term, these next couple of months, you know, kind of taking the vaccine is not going to have a massive impact on that huge group of people in the next coming months. So is there anything else you can do in this?
Yes, we are going to maintain the mitigation steps. There's no discussion around any of those steps being lifted at this time, of course.
Let's go to German.
Everyone in your administration talked about how the primary source of COVID spread right now is these small gatherings, not for businesses like restaurants and bars. There seems to be no plan to enact any sort of mitigation measures that would, inhibit those kinds of gatherings or make them smaller. I mean, is there any point, doesn't it make sense to try to curb those kinds of gatherings if that's where most of the spread is coming from?
Yes, It does. So let's curb those kind of gatherings. I don't know what role you think the government can have in private home settings. That's why we're trying to educate the public on the best possible policies and protocols. And by and large, most people are listening and following. The irresponsible behavior you've seen is, of course, happens, but it's more now and again, and that's what we need to limit. We want to gather during Christmas and the holidays. It's natural, and it should be. We're going to continue to over-communicate so that we can slow this spread as much as possible. Other places canceled Thanksgiving or use those kind of words, or they put things out there that are toothless and unenforceable. I'm not in the business of doing that. We're putting out measures that will be effective. We're doing everything we can in the public square to slow the spread of this virus and have broken up every large gathering within our authority. Now we're asking for people to be personally responsible, and I'm confident they will be.
Let's go to Steve from Channel 10.
I want to switch gears to unemployment, talking about that personal responsibility. This month, DES said everyone on PUA, they have to verify their identity to continue to receive benefits. This week, only 69,000 people were able to claim benefits, as opposed to 270,000 2 weeks ago. A lot of fraud in the system, everyone knows that, but if you talk to any expert, they'd say tens of thousands of people were kicked off unemployment this week. Just a week before Christmas. What are your thoughts for them, as these are people who've lost their jobs through no fault of their own, and now they've lost their unemployment the same way?
Well, I want to say first, my heart breaks for anybody who's been displaced during this pandemic. In early February, we had hundreds of thousands of people that were likely gainfully employed in possibly the top paying career post that they had been in. That was where Arizona was as a state. And these are folks, by and large, that have never asked for anything from the government. And all of a sudden, through no fault of their own, they have no income. So we have ramped up from what I think was 17,000 claims for unemployment in the state of Arizona in February to over 1.5 million people have received in excess of $12 billion of relief funds to allow them to navigate through this most difficult of times in our lifetime. While that has been going on, there have been out of state and out of country bad actors, criminals, committing fraud, setting up accounts so that they received these hard-earned taxpayer dollars and they've stolen them. Steps have been put in place so that there is verification and that it's Arizonans who have been displaced that have been getting this money. It's been a monumental challenge for the Department of Economic Security, and it likely will continue to be in the short term, but they're doing everything necessary to, one, make sure the people that are committing fraud are not receiving these dollars, and that the people that do need it are getting it.
So let's talk about then the unemployment part of DES as a whole then. This year, they said that every month they did internal reviews to see how they were doing. They haven't. They haven't done one since January. If you go back to last year, 11 out of 12 months they failed to meet every single federal accuracy benchmark on sending out unemployment benefits. That's 2019. That's before this onslaught. So at a certain point, is the unemployment part of this agency failing at doing their job?
This agency has risen to the occasion, and it's hard to just single them out because, you know, who has had a bigger challenge, the Department of Health Services or the Department of Economic Security in this pandemic? It's under new management. with a new director who's off to a very good start, and there are things that need to be fixed in the agency, and I'm confident that the bureaucratic type review process that you're talking about will take place, but their first concern right now is getting dollars into the hands of Arizonans who have been displaced and stopping foreign fraud from happening in our state.
Let's go to Dennis.
Yeah, I just want to start, I didn't want to ask you about mitigation, because it's clear you're not going to be taking any more mitigation measures at this point, even though it's very clear. The current course has not worked. It's been in place since the summer. We are now seeing a spike. The numbers just tell the story. It's not been effective. However, healthcare experts have told you there are ways that you can slow the spread and save lives. You said you listened to them, but yet you dismissed their advice. At the end of the day, are you going to be okay knowing that you could have taken steps to save people's lives, but you didn't?
I wish the reporting was a little more accurate on this, on the mitigation steps that are in place and where there is not accountability around those steps. Those are the steps that came from the White House Coronavirus Task Force, that when they are followed in the proper protocols, and we're hearing a lot from people, and it's interesting to me that people with a guaranteed government paycheck are asking us to throw hundreds of thousands of people off the employment rolls just before the Christmas holidays, when the evidence is that that wouldn't do very much, if anything, to slow this spread. Where the spread is coming from is private gatherings of larger groups. Those are the facts. That's where we need improvement. And if we would have improvement on the other measures, some type of local enforcement besides the Department of Health Services, that would be helpful and effective.
Do you have that data? 'Cause I haven't seen that data where, like, the contract.
Yeah, we'll get it to you.
Well, because people have asked, and we haven't been provided that. I would like to get that information. And secondly, I do want to ask about the vaccine. Dr. Chris is going to be getting vaccinated later to show confidence in this vaccine. But you are not. Now, I'm not aware. I don't think Dr. Chris falls under that.
She falls is a healthcare provider. She falls in the first batch. Dr. Christ is going to be getting a vaccination.
Because doesn't that suggest that you feel the public is more confident in her in this crisis than you?
I think right now I want to make sure it's our doctors and our nurses and our frontline healthcare people that are protected, so that they can protect our elderly and our most vulnerable.
And one final.
She's not in 1A where those healthcare workers are.
Question?
I got one more question. I just want you to respond to Shelley Gentry-Reed has filed a bill today that would take your power away in these kinds of emergencies. Would you care to respond? I mean, because you won't, if it does pass, you don't get a chance, because you won't get a chance to veto this bill.
We've got letters that are coming to us with advice on all the industries that should be shut down, and we've got letters that are coming in the middle of the height of the pandemic, lifting the emergency order. What we're focused on are our healthcare providers, our hospitals, and these vaccinations. That's our priority, and that's what's most important.
I want to make sure everyone has the opportunity to ask at least one question. Let's go to Craig from the Republic.
Merry Christmas.
Merry Christmas, Craig.
Couple questions related to COVID on paycheck protection programs.
Mm-hmm.
Loans. Over 100 charter schools got those loans, and they were fully funded. As a matter of fact, you and the legislature gave them more money so they could increase teacher pay.
Mm-hmm.
So two questions. Primavera got a $2 million loan, and it gave a $10 million shareholder distribution to its biggest shareholder. Superintendent Hoffman said maybe you or the legislature should look at lowering the funding for virtual charter schools because they really seem to have a lot of money. So that's the first question, if you could comment. And second, there's been calls from the Education Association that the charter schools that got these PPP loans should either get the money back or they should be cut their state funding because they have an unfair funding advantage. Can you answer those two questions?
So on the first question, what I would say is the Paycheck Protection Program is a federal program. So I think it's more of a question for the feds or for Treasury on the guidance. I also know that organizations that received PPP funding are subject to audit from the feds. So, I mean, the next steps are in their hands. And I don't separate out schools. These are all of our kids across the state. These are the children of the public of Arizona. I want to make sure that all of our public schools have available funding and that parents have the opportunity to get their school into where they think their child will have the best educational experience and learn the most. That's been our focus.
Appreciate that. You didn't answer my question, sir. So do you think
That is my answer. I'm not going to differentiate out from charters or district schools on this. We want them to have the available funding.
there shouldn't be any reduction in funding for virtual schools and the charters that got the PPP loans, even though it gives them an unfair funding advantage, that it's okay?
I didn't say it was okay. I said it's subject to federal audit. It's a federal program.
Let's go to Alejandro from Univision.
Governor, the goal is to mitigate the spread of the virus through the vaccine, that was talked about. In the meantime, the hospitals are filling up. What are the current efforts if we do run out of bed capacity, for example? Are you guys working on creating extra beds or even temporary hospitals anymore?
So thank you, Alejandro. And of course, I mean, the first metrics that we start out with every day is around hospital capacity, ICU capacity, ventilators, the stress on our emergency room and their departments, the amount of discharge that we have of people that have gotten better and are able to leave the hospital. That's top of mind at the first thing every morning and before we go to bed that evening. We will continue to monitor that and be vigilant about that, not discount the situation that we have at all right now. The concern, first and foremost, is not so much about beds and capacity as it is around staff and help and relief for the people that are working so hard through this pandemic. It's part of the reason that we've brought millions of dollars to this effort, and they're just not dollars to be spent, they're dollars to bring in other resources for relief and for help. That is really where the major stress is right now and where relief can be provided. We do have the opportunity, if we were to need more beds. We've been talking about that since July, and the Army Corps of Engineers was here. To date, we have not needed that. But of course, it would be available if necessary. What's more important is the personnel and resources.
Talking about the staff that you announced last conference, where about 500 nurses would be, and hospital staff would be hired for the additional 65 million. Where are we at on that?
I'm gonna let Dr. Chris talk about the resources and the staff that we've been able to bring to the fore. Doctor?
Thank you. We've been working with our contractor to bring on, we've identified 68% are being onboarded and will be here. Some are here already within the state. Some will continue to come in over the next few weeks. And it's a total of about 700 to 800 nurses will be coming into Arizona through that contract. But from the most recent update, it's about 68% have been procured.
So let's go to Dylan and then Michael from Channel 12.
Hi, Governor. I just want to follow up on Dennis's final question about Senator Rita's resolution, which does not require the signature from the governor to go into effect. If it were to overturn the state of emergency that you issued months ago, are you concerned? Because there's a lot of executive orders that are relying on the state of emergency to continue to be in existence, including, I believe, the vaccines being free for all Arizonans. So if it were to pass, then all of that would end.
We're in a state of emergency. We're going to continue in a state of emergency until that's no longer necessary. In terms of a letter that's been written or something like that, my focus is on the challenges we have in front of us right now.
I mean, it's legislation, it's not a letter.
But the legislature's not in session. They won't be in session until January 11th.
Let's go to Michael.
Moving on. The eviction moratorium ends at the end of the
And I look forward to seeing them.
Are you going to extend the eviction moratorium before it expires at the end of the month?
So we're focused, of course, on making sure that we've got all the resources out there so that we can avoid that to the largest degree possible. And, you know, it's interesting in these press conferences that the first part of the questions all focus on what industries can we shut down and how many people can we throw out of work. And then the second part is how can we keep them from being evicted from their residence or their apartment. We do have state funds available for this. Congress is also looking to act in terms of extensions, but the best way to keep people inside their homes or apartments is to allow them to be safely and successfully employed so they can pay their rent or pay their mortgage.
So does that no, you're not going to extend it?
We're working with whatever the federal plan is right now, and then there will be more to follow on that.
Michael Council.
Yeah, there's been a lot of talk throughout this press conference about measures, what steps we can take. Let's just ask it simply this way. Are the steps we taken, in light of the numbers we're seeing right now, adequate?
These steps will make a difference if we have accountability around these steps. So a lot of people ask for local enforcement. I'm all for it. Let's see accountability.
Well, wouldn't a statewide leadership, whether it's mass mandate or something like that,
You can't participate in any part of our economy without wearing a mask. Okay? People are wearing masks, and I encourage them to continue to wear masks. Are there new questions?
yeah, do you believe that a statewide mass mandate or maybe some
I think we're.
let me finish the question, Governor. I'm sorry if
Okay.
I'm going to finish the question. Will you please, do you believe that a statewide mandate like that would be counterproductive?
I want people to wear a mask. Our state has higher mask participation than states that have been doing this longer with toothless mandates that cannot be enforced because Arizonans have common sense.
Saying it would be ineffective if you
I'm saying we're doing everything we can to be as effective as possible.
Let's give other folks an opportunity to ask questions. Peter from KTA.
Hey, you know, I want to say something to that. I want to say, if there was any state out there or any governor out there that was pitching a shutout, okay, we just take their game plan and apply it here. Everybody, everywhere, in every state, in every county, is going through this. I'm doing what I believe with the guidance and counsel of the smartest people in the state, in the country, is the best plan for Arizona. And that's what I'm going to continue to do.
no other steps that could maybe lower down the amount of runs?
I've answered this question at least 5-6 times today already.
Michael, let's give someone else a chance.
Governor, thank you. So I know Dr. Chris is taking the shot today as an example and to encourage confidence. And I know you're waiting your turn.
Yes.
But would you consider moving up on the line, so to speak, to also encourage more Arizonans to take the vaccine? And then I'd like to talk to Dr. Crystal about what her thoughts are on taking the vaccine herself. But what about you first?
Well, if we had enough vaccine for everyone in the state and I wouldn't be cutting the line, I would take it today. What's more important is that our healthcare providers have this. We only have 380,000 of these vaccines available, and in terms of the number of folks that work in healthcare, along with our elderly and most vulnerable in long-term care facilities and skilled nursing, there's just no chance that I would cut in front of any one of them. After that, we'll have more plentiful vaccinations available, and I'm not going to cut the line because I think it's more important for these people, especially in an age category or having underlying health conditions or comorbidities, which I'm fortunate enough to not have or not be in that category. So, of course, you think I would take the vaccine before my grandmother would take it? There's not a chance.
Okay, we have time for one more question. Let's go to Cameron.
Yeah, hi, Governor. I'm actually focusing on vaccines with you guys right now, and I want to know that one of the big questions I continue to get emailed to me is not only when can I get it, but how will I be contacted to get the vaccine? How will I know that this is my group, this is my time. Can you talk about the state's efforts to get that messaging out when it's time? And then I'd also like to know the logistics of getting vaccine to long-term care facilities. How will the National Guard play? Will they take that vaccine directly to those facilities?
Thank you, Cameron. Thanks for focusing on the vaccine. I know there's a follow-up that was asked for Kara Christ on her vaccination. She's also been the leader of the vaccination distribution team, so I'm going to let her address both those questions. Doctor?
That is a great question. So we are working with our healthcare partners right now on the Phase 1A. So those are the healthcare workers. Maricopa County and Pima County are standing up the first pods and have sent out emails through the licensing boards, through the associations, through healthcare employers, through the department, through health alerts to get individuals pre-screened. If they meet this pre-screening criteria, then they will receive the ability to make an appointment at the pod site near their home. We will continue to work. So the long-term care CDC pharmacy partnership, they are contracting with large pharmacy providers, so CVS, Walgreens. 100% of our skilled nursing facilities, so there's about 146 of them statewide. Walgreens will call them, make an appointment to go in. They will bring all of the staff, all of the supplies, all of the PPE to vaccinate those residents and the staff, and then come back at the time that it's supposed to come. So they are taking some of the state's allocation in order to be able to vaccinate on site.
And for those groups that follow 1A, because obviously we're letting people know. Everybody knows 1A. How will they know when they're 1B? Well, even 1B, we're going to find that communication is easier. But 1C and then group 2 is when people really want to know. Those are the majority of people asking, how will I know when I can sign up for vaccine? When that time comes, what will that look like?
So that will look a lot, we will be trying to communicate that through various ways. So some of it will be communication through you guys to announce we are in Phase 1C. Our website will say it's in Phase 1C. Here's where the sites are that they can get. But we will also be sending out reminders to healthcare providers, to employers, to those groups that are in high risk. So trying to get it out as far and wide as we can. And we continue to develop a communication strategy and a messaging campaign in order to be able to do that and to let people know when we go from 1C to the general population and how you get that vaccine as well.
Okay, thank you, everyone.
I want to just, in closing, thank you, Dr. Christ. In closing, I want to say 1A, Cameron, you're right about that, is going to be different than what follows. So we will be communicating heavily on vaccines, vaccinations, and much like you saw testing start out slow and difficult, we don't expect that because there's been so much preparation around the vaccination. But as we expand it and extend it and reach out to further parts of our states where it's less population, we'll be over-communicating on that. The media was helpful early on in the pandemic, and I want to say thank you for that. If you remember one of our first press conferences, I asked for your help in communicating to people around the stay home, stay healthy, stay connected order. And that communication was heard by Arizonans across the state, and it allowed us to kind of navigate through the fog and stock up on our PPE, get our ventilators, get the surveillance around our hospital beds and our ICU capacity in preparation for what would follow. I today would like to ask the media and thank them in advance to help us communicate about vaccines and vaccinations and to build confidence in something that is a modern day medical miracle and will save lives. There is no more effective tool that we have in front of us, and of course, we are going to stay vigilant for the short term. But this is something that is not that far down the road if we're successful at it. And at a time where there is so much distrust and misinformation, let's make certain that the facts are getting out on these vaccinations so that Arizonans can save loved ones, get back to a normal way of life, and focus on the future. In the interim, I know people are planning whatever is going to happen over the holidays and Christmas at this time. So I want to reiterate one more time, please bring this discussion so how you do it in the safest way, in the smallest gathering, and connect with the most vulnerable virtually, if that's the appropriate way to do it. Thanks, everyone.